Welcome to Speaking Books. Literacy is a luxury that many of us take for granted. It's hard to believe, but nearly 1 billion people, or 1 in 5 around the world, cannot read. Without the ability to read, people are 12 to 18 times less likely to understand healthcare instructions or navigate the healthcare system. The net result is that people are left without access to critical information necessary for a healthy, productive, and sustainable life. Low literacy creates a challenge for organizations needing to deliver life-saving messages. In the words of the late Jack Waters, Vice President of External Medical Affairs at Pfizer, "You've only done half the job by producing the medicine. The second thing is to making sure that they get to the right people and they understand their safe and proper use. That's the power of the speaking book." Today's most common method of healthcare education is through community workers, but these can be very expensive and not always effective. Speaking books solve a critical challenge by bridging the communication gap between the first world organizations and communities in developing countries. By being able to see and hear the information, even low literacy communities can be educated about important health messages and empowered to take charge of their health. So, what is a speaking book? Well, it's just what it sounds like. A book that talks. Instead of relying on users to simply read the information, our books contain pages of colorful, culturally appropriate illustrations accompanied by straightforward and easy to understand text and soundtrack in the local language, read by a local celebrity. Speaking books can be created for any topic and in any language. Why are speaking books unique? It's an incredibly cost-effective solution. A recent UNICEF study indicated that each book reaches over 120 users and that it is an invaluable leave-behind edutainment tool that can be shared by the community. The messages are always seen, read, heard, and understood, regardless of the level of literacy, and can be played over and over again and in any order. Our sponsors and partners span the world's leading health and education organizations, from USAID, UNICEF, UNESCO, to CEDA, Pfizer, GSK, Merck, Lilly, Save the Children, Sesame Street, and Rotary International. The list keeps growing as more people get to know and use our speaking books. With an incredibly broad range of applications, speaking books are used throughout communities around the world by youth groups, community workers, patients, caregivers, students, children, and many more. Possibilities are endless. We're making a tremendous global impact. Today, speaking books have been created in 35 languages, span 30 countries, and covered over 65 healthcare and literacy topics. We have distributed over 500,000 speaking books, received 11 international awards, and partnered with 34 global organizations. There's been considerable research, monitoring, and evaluation of speaking books, all of which can be downloaded from our website. It's worth noting that the UNICEF study in Ethiopia highlighted that on average each speaking book reached 128 people and helped health workers gain community acceptance. The messages were considered as expert advice and were trusted more than the messages delivered solely by community workers. Soundtrack was found to be the most informative aspect of the books. When comparing the total cost of sending community workers into the field to deliver healthcare messages against the cost of using speaking books for the same purpose, the savings are enormous. And you are leaving behind an inexpensive communication tool that can be used over and over again. The use of speaking books has been well established for a large number of health and literacy interventions. For example, to ensure informed consent in clinical trials, pharmaceutical companies and CROs like Pfizer, GSK, Sanofi, INC, ICON, and Eris have invested in speaking books. Higher literacy rates present legal and ethical challenges in ensuring proper understanding of the process and the patient's rights and obligations. The clinical trial speaking books clearly explains the informed consent process and have been endorsed by the World Medical Association in compliance with the Helsinki Accord. Driven by USAID and in partnership with Sesame Street, speaking books have been created to promote early childhood literacy, teaching children the look and pronunciation of each letter of the alphabet as their first step in learning to read. Another critical intervention has been our partnership with UNICEF and Rotary International to teach vulnerable and low literacy communities on the absolute importance of immunization to prevent the spread of polio. Our first speaking book on polio prevention was created for Pakistan in Urdu and Pashto, and following its success was rewritten and translated into Hausa and English for Nigeria. Now that Nigeria has been declared polio-free, we are adapting the speaking book for Afghanistan. Hand washing with soap is the most effective health intervention. According to UNICEF research, washing hands at the appropriate times reduces disease by 48 to 59% and is also by far the cheapest intervention. Together with UNICEF, we created the Sopo Speaking Book to teach children the importance of hand washing with soap. We're now looking to extend this initiative to as many countries as possible, in partnership with UNICEF and Rotary International. Speaking books have covered a vast number of health topics, 65 so far and counting. There isn't a healthcare issue or community that cannot benefit from a speaking book. We write, illustrate, record, and deliver culturally appropriate speaking books to meet every need. So please contact us today to learn how we can partner with you to reach the world's most vulnerable and underserved people. Together we will make a difference. Visit our website at www.speakingbooks.com and contact us by email at info@speakingbooks.com. Also follow us on Facebook, Twitter, and LinkedIn for all our latest news. Thank you so much, and we look forward to hearing from you soon.